Well, welcome everyone. So awesome to see you all here today. I'm Katie Hopling. I'm the Executive Director for the Alliance of Nurses for Healthy Environments. And just a little housekeeping before we get started. We are able to offer 1 hour of free continuing education credits for nurses today. And so be on the lookout in the next day or two. It usually takes us a couple days to send out the email, but it'll have a link to do a post-test and evaluation. And you need to complete all of that in order to get the 1 hour of continuing education credits. And with that, I will turn it over to Teddy.
Wonderful. It is just my joy that you're all here to be part of this today. And I'm going to talk a little bit about Nurses Drawdown. So we're all on the same page. You might already be aware of Nurses Drawdown, but I want to just do a general sort of connection of what it is before I introduce our panelists. So Nurses Drawdown is a global movement supported by over 16 professional nursing, national and international nursing organizations that allows nurses to participate in partnership with Project Drawdown on evidence-based solutions that help draw down our greenhouse gases. The nursing sort of owner or site that manages Nurses Drawdown is the Alliance of Nurses for Healthy Environments. And I am so grateful for their support and their partnership in all of this. And I have particular fond spot for Dr. Katie Huffling, who soon to be Dr. Katie Huffling, who did a great deal of this work on Nurses Drawdown related to her doctoral work. And so she is to be celebrated and honored for being the grandmother or mother of this global movement. So Nurses Drawdown, again, nurses are a profession that practice according to evidence-based practice. And we didn't want people to be proposing solutions, teaching our patients and communities about solutions if they did not have adequate evidence to support them. We also didn't want to suggest solutions to deal with climate change that did not match the urgency of the crisis. We have to scale this and scale this very quickly. So I approached Project Drawdown and several years ago and just said, nurses are the most trusted profession there is. Year after year after year, 20 years in a row, we've been voted the #1 most trusted profession. Can we leverage that trusted confidence that the public places in nurses to scale drawdown solutions? And we decided that Project Drawdown said, yes, we would love to work with nurses. So the Alliance of Nurses for Healthy Environments started to assemble a group of nursing leaders from around the world to work on this project. We chose 5 main solutions so that we could, and our bottom line, because Project Drawdown has over hundreds of solutions, we chose solutions that have co-benefits. If we do them, and if our patients and communities do them, we improve human health and we improve the health of the planet. And we found 5 that are key areas of involvement. And each of them is being hosted in a webinar during this time of the spring. So Annie will have recordings on these. Renewable energy and efficient use of energy was one of the ones we chose. We chose actions around food. So that was plant-based diet, clean burning cook stoves, and decreasing our food waste. We chose educating girls, which is a very significant approach to climate change and has a great deal of impact. So the global education of girls and reproductive rights of girls. Bikeable cities, mass transit, and ways for people to get around efficiently without burning a lot of fossil fuels. That was another choice. And then today is nature-based solutions. All of these, as I mentioned, have a core piece that helps human health improve. So today we are delighted to bring you nature-based solutions. We all felt as nurses very strongly about this. And that, as I said, there are co-benefits here. So human health improves when we are surrounded by green space and forests. We know, and I'm not going to cite all the studies, but there's studies that show that being around trees actually enhances our immune system. It reduces stress. It lowers our blood pressure. It improves our mood, decreases anxiety, and decreases depression and sense of anger and violence. And it promotes a faster recovery following surgery. So if people look out on a brick wall, their results following surgery are different than people who look out on a green space or a park. People who look out on a green space actually recover faster, have decreased complications, and need less pain medication. So there's amazing things that trees do for us. Now it's our turn to do back for trees. And that brings us to today of how do we partner? How do we work with our environment to ensure that our forests are healthy, our communities are healthy, and together our future is healthy? So it is my absolute delight and honor to introduce our panelists today. Millie Elia is a nurse practitioner and consultant on green space healthcare initiatives, and she's also the nurse project coordinator at Shift. Our second speaker is Johannes Heydrich, and they are ambassador for the Planet Academy, and has been since 2012. And so we're getting two different approaches, the benefit of trees for health and the benefit of trees for the planet. And we're delighted to host our speakers today. There is a question and answer time at the end of their talks. So please put into the chat any questions you might have for either of our speakers, and those will be reviewed at the end, and we will enter a discussion together. So now it is my pleasure to stop this and pull up Millie's slides, and we'll go from here. Okay. Great.
Thank you, Dr. Potter. Yes, as Dr. Potter mentioned, I am an adult nurse practitioner. I have spent the last 25 years in nursing in the world of oncology. That is my specialty. I'm now working in the community in the area of supportive care. I also have my own business service in which I'm a consultant on green space healthcare initiatives. So when I was given the opportunity to participate in this webinar, I couldn't have been more excited. Dr. Potter, next slide, please. Now I just want a little disclaimer. The world of research, as Dr. Potter mentioned, around this is enormous. It really is. A lot of that is coming from other countries and the UK, but there's a lot of evidence-based research behind this. I couldn't possibly talk about all the elements, so these are going to be broad strokes of the benefits. Quickly, an overview is globally, research is increasingly demonstrating that nature-based solutions can deliver significant health benefits for patients, both in disease prevention and in healing through nature exposure post-treatment. So there is that therapeutic aspect as well as prevention. In this presentation, I'll be discussing some of the most recent evidence supporting these therapeutic health benefits. Thank you. Next slide. So I just made 4 main objectives that we'll just be touching on briefly, reviewing the increasing global evidence on 3 significant health benefits of exposure to nature, coming to understand the relationship between health inequities and a lack of community access to trees and other green spaces. We're going to discuss how to translate that knowledge into patient-centric nursing recommendations. And lastly, we're going to explore ways that nurses, as change agents, can engage with inter- and transdisciplinary stakeholders to leverage change and move us forward. Next slide, please. So what is the evidence that supports the role of green space in a sustainable health system? What's the connection? Next slide, please. We're going to look very briefly at the mental, physical, and emotional. Mentally, the research shows us that, well, to start, we all have an intuitive feeling when we enter into nature, whether that is sitting in a park, hiking, going by the beach, whatever that looks like to you. We all have this sort of intuitive connection. But what the research is showing is that mentally speaking, people living in currently or that move into greener areas go on to have better mental health. For people in the most socially disadvantaged neighborhoods, access to green spaces in childhood is linked to lower anxiety in older age. So that means to say, if in your childhood will impact your future. And so having less green space as a child, that can impact how anxious you become as an older adult. Pioneering research also shows that in terms of neural waves, our brain waves, suggests that time spent in green space actually buffers our response to demands on our attention that a busy urban environment might make. So and that can, I think, apply to a busy work environment, a city-like environment. Whenever we have, the dings and the bells and all of these things are causing kind of sensory overload, neural waves will become calmer in when we're exposed to nature. Looking at physical components, access to green spaces related to lower mortality, overall mortality from cardiovascular disease. So in nursing, we all know about what contributes to obesity and what obesity brings with it. And so we see lower rates of obesity with more green spaces, lower levels of type 2 diabetes. And emotionally, we have research shows a higher level of sense of well-being. And this can never be downplayed. It's last, but it's never least. Next slide, please. So here we have a model by Barton and Grant, and it looks at the natural environment as a social determinant of health. So to quote the Marmot Review, inequities in health arise because of inequalities in society, in the conditions in which people are born, grow, live, work, and age. So this model I loved because it really broke down the layers and how today's webinar fits into this model and the importance of it. So the model shows the different determinants of health and well-being in relation to a human habitation. This includes, I think you can see towards the top, this includes the natural environment of neighborhoods and communities. So this blue circle model represents the various layers, and you can see that the placement of the natural environment towards the top includes things like trees, air, water, land, and soil. Looking at this model and understanding the breakdown of what really makes up social determinants of health, then the evidence around having safe, accessible community access to green spaces becomes much easier to understand, and the importance of the natural environment in its placement as it pertains to health and wellness. Conversely, it becomes obvious how a significant neighborhood lack of green space and tree canopy would adversely impact the health of communities and individuals. Look, with COVID-19, the pandemic, we've all seen the spotlight being thrown on aspects of the link between human health the environment, and health inequities. And so then we are obligated as healthcare professionals to consider the natural environment when we talk about nature-based solutions in addressing health inequities. Next slide, please. So to recap, green spaces are considered both salutogenic and equigenic. Oh, those are tongue twisters. Beginning with the first one, salutogenic. This means it has the potential to cause health and well-being. And equigenic, having the potential to reduce health inequities. So nature is both of those things to us. The development of safe and accessible community green spaces both contributes to the promotion and maintenance of physical and mental well-being. And it supports the health of the less advantaged and marginalized communities. Now, notice I keep saying the word safe, right? Because you can have access to green spaces, but it may not necessarily be perceived by the individuals in that community as being safe. So that's an important consideration. Now, green prescriptions, which are being used by healthcare clinicians in both a preventative and therapeutic manner, can, if you're interested in knowing more about that you can receive training in that area. Green prescriptions are being more accepted, as I say, in areas like our neighbors in Canada, in the UK. It's being looked at by medical professionals as a way of sort of prescribing to people, to patients, how much nature can impact their health. So there are ways to look at this, but to use it in a therapeutic manner, you do need extra training. However, when prescribing nature-based care solutions, so I can recommend to somebody, yes, go sit in the park for, you want to do 150 minutes a week. When you're prescribing these things, the practitioner, the nurse, the clinician must take the patient's perspective and personal experience into account. This is not a one-size-fits-all solution. So particularly important is to consider what is not only accessible to the patient, but what their preferences are. And so when I say patient-centric, that's what I'm talking about. It's thought that 120 minutes a week, of nature exposure is beneficial. But consider that anything less than that will still positively impact the individual. And we also need to be willing to reimagine and co-create with the patient what this interaction looks like to them, because not everybody has the same ability to access green spaces as everyone else. So we have to really look at that person's individual needs. I offer 3 examples, very basic, of nature-based solutions within the community setting. So some suggestions might be for someone who is homebound, let's say, planting, or if they have a garden in the backyard and they're not homebound and they prefer to stay within their own home setting, gardening, looking at the home environment, where the person lives. So we'll get more into that in a moment. But as Dr. Potter mentioned, even looking at landscapes, at plants, having those access to just those visual stimulus is very soothing. Our brain believes what it sees. So when we look at a landscape, when we have plants around us, when we maybe use audio stimulation, hearing raindrops or birds or crickets, these things actually do affect us physiologically. And when we're talking about communities at large, developing programs and encouraging the development of programs for neighborhood walks and community, just in general, community outdoor programs. There's some wonderful work being done by nurses in this respect. Next slide, please. Apologies, I just lost my place a little bit. Oh, here we go. So remember when I talked about the home environment? Well, there's a term for that, and it's called biophilia or biophilic design. And so what that really is a concept that was used within the building industry to increase occupant connectivity to the natural environment through the use of direct nature, indirect nature, space and place conditions. And so what that means is a lot of what I talked about. What you see is going to have an effect on how you feel. So there's a great deal of evidence on the benefits of green space for health. Now, granted, fewer studies have focused on the effects of green space within the clinical setting. But those that have show that sunlight and nature improve mood, reduce pain, and shorten recovery time. For example, patients recovering from abdominal surgery with a view of trees rather than a building have shorter recovery times, require less pain medication, and report that important emotional well-being. They also have fewer minor complications, it was found. Heart surgery patients given pictures showing well-spaced trees and water require less pain control than those that saw abstract pictures or had no pictures to look at all. And here's my special interest. Female chemotherapy patients given a virtual reality, because now they're using that at some clinics, the VR set, and allowed to walk through a forest with bird sounds, experienced less discomfort and symptomatic distress. Patients undergoing spinal surgery, recovering in rooms with more sunlight, report, again, less pain and stress and take less medication, pain medication. In a qualitative study of gardens in healthcare settings in Australia, patients said gardens made them feel connected to a larger world and a sense of normality. Next slide, please. So remember I spoke of us as change agents. Well, how do we get this change going? I've given 5 very simple examples as suggestions, finding the levers for change. So on top, we have our healthcare centers, looking at who you can engage in leadership at your particular facility on projects that support development of green spaces. And again, this can be very simple. It is ultimately cost effective, but it can also begin cost effectively. Looking at how to develop these green spaces and increase trees on the hospital campuses. Finding those potential champions who you know have more of an ear for what you're trying to institute within the system and creating that engaging conversation. Remember to point out the value-based approach. So know who you're speaking to. You want to talk about the facts and figures, improve patient outcomes and satisfaction, the address of cost saving and staff retention. You'll also notice professional bodies here. So we're talking about policy change and beginning with educating and inviting colleagues into conversations and creating momentum through talks and educational workshops just like this. Most of us belong to a professional body, and there's always a room for a speaker or a presentation. Looking at sources of funding for best practice. Well, in that case, you want to look at places like in the United States, there's the NIH. That's just a quick example. There are many other sources of funding for best practice. And there are many nature-focused charitable organizations. So partnerships and collaborations are absolutely available. I highly recommend it in my own work because that transdisciplinary experience is very important. I am not I'm not someone that learned this, about gardening and all of that in school. I'm a nurse, and that's what I do best. So having those partnerships and those collaborations are very important. Wherever you are in the world, wherever your region, there are nature partnership organizations that are willing to speak with you. And what do I have in the very center? Community representatives. And what do I mean by that? I mean to say, engage the community leaders. Who are the patient-led groups in your facility? I purposefully put that in the center because that is the center of everything we're talking about. Next slide, please. Here I've listed some of my references, most of my references, and I've also tried to provide you with just 2 resources, but honestly, there are many, many more. The Arbor Day Foundation here in the United States is very helpful. They actually have a tree campus healthcare initiative themselves. I've been in connection with them. They are very willing to help talk, very willing to speak with you. And then of course, the Alliance of Nurses for a Healthy Environment. And next slide, please. Thank you. I've come to the end of my presentation and it was a pleasure speaking with you.
Millie, that was so inspiring and so grateful to see a nurse in action on nature-based solutions and a provider actually working it into your experiences. So now that we know that trees are absolutely one of the most powerful medicines that nurses have access to, let's figure out how we plant trees and how we care for our forests. So again, it is my great pleasure to introduce Johannes. And I'll pull up your slides, Johannes, for this next part.
Thank you very, very much for this nice introduction, Dr. Potter. I learned new things about the health effects on us people from trees, from your presentation, Millie. Because before I was always more, put the focus more on the CO2 benefits of trees. And that's what I want to talk to you now about the benefits of trees for our climate. But first, I am really happy to speak to so many people. And second, it is an honor to speak to you who are really engaged with your profession against the corona pandemic. Because you are the people who are really in the middle of this pandemic, which all the world is talking about. And you are the people who really help the people who are who have been diseased because of corona. And it's nothing greater than to help people who have really to struggle. So thank you very much for your great work. And thank you all the more that you are still interested in this climate topic, though the corona topic is at the moment as big as the climate topic. But we all know that if we don't face the climate crisis, then the climate crisis can become a worse problem than the corona pandemic. So we have to tackle both corona pandemic and climate crisis. And we don't want only to talk about these topics, but also to act. And that's why our slogan is stop talking, start planting. Next slide, please. We are many children and youth, about 19,000 in the world. We were founded in Germany. And I am Johannes Heydrich. I come from Germany and I'm 20 years old. And since 8 years, since 2012, I'm an ambassador for climate justice in the organization Plan for the Planet. And like on the picture, I also took speeches and planted trees by myself and collected money for our tree afforestation projects. Next slide, please. Why we do all this is that we see already the consequences of the climate crisis. This is a picture, and maybe you have already an idea what this picture is showing. It's one bar for each year from the beginning of the weather measuring. They began in 1881, and 9 of the 10 warmest years ever
I think we lost your sound, Johannes. Did it get muted by accident?
I don't think so. It looked like it froze on my end. Johannes, maybe try turning off the camera. Hope we didn't lose him. Let's see.
Sorry for this technical interruption.
No problem.
Next slide, please. Yes, and this show that 9 of the 10 warmest years are in the 21st century, and so we know that it's time to act to work against the greenhouse gas effect. Please, next slide, please. This is a little graph which shows that it's not enough only to reduce CO2, but that we need to plant trees in addition. The Paris Agreement from 2015, where the all countries in the world gave the permission that we will keep the global temperature rise below 2 degrees. After this permission, every state, every country gave so-called national determined contribution NDCs to the UN, to the United Nations, and scientists calculated that all this national contributed and all this national determined contributions would lead to a temperature rise of 4 degrees plus. So we need to close this gap between 2 degrees plus and 4 degrees plus through afforestation, and to avoid the worst case that we have maybe 6 degrees plus, then we need to reduce our CO2 emissions in addition to the tree plantings, or vice versa, we need to plant trees in addition to our CO2 emission reductions. Next slide, please. We plant trees and do actions to put the focus on CO2 reduction. We have, of course, also parents and adults who help us children with that. Next slide, please. Next slide, please. Why trees and not, for example, flowers, or why trees and not yes, because trees have a great skill. God gave us the skill to need that we need food to live, and God gave the trees the fabulous skill they need CO2 to grow and to live. So trees make from this CO2 their body, and their body is timber. It's genius. We can breathe out CO2, and we have a certain amount of CO2 through production and, for example, car driving, which is allowed, and trees can bind this CO2 and make timber from it. Next slide, please. And next slide, please. These pictures show the founder of our organization, Felix Finkbeiner. He founded Plant for the Planet 14 years ago in 2007, and he spoke in front of the General Assembly of the United Nations and convinced many other children to take part in Plant for the Planet. And this picture shows where Felix Finkbeiner is introducing the Plant for the Planet app. Next slide, please. Plant for the Planet did a study on afforestation because our aim is to plant 1 trillion trees by 2030. And a study found out that there is space for 1 trillion trees. At first, the study found out that 3 trillion trees exist. Before the Industrial Revolution, 6 trillion trees existed. Today, it's only half of this amount. And to bind 1/4 of the human CO2 emissions, we need to plant 1 trillion trees on top. Next slide, please. The next picture shows that where is space for 1 trillion more trees. And this picture and the study put a focus that no tree has to plant on a field or on an area where you could produce plants for humans. So it's very important that this tree plantings don't disturb agriculture or don't get into conflict with agriculture. Next slide, please. Our planting area is in Mexico, and on our app, many other organizations are listed which plant trees in other areas in the world. Next slide, please. This is beside the effects on the health, the physical and the mental health of persons, of people like us, is that the tree plantings provide jobs, like you see on this picture. In our tree planting in Mexico, 100 new jobs were created, and which is very new for this region is that the people have social insurance. And when we plant trees and when we grow trees in tree nurseries, and after a few years, when we cut the trees down and make wood and timber products out of it, and of course plant new trees, that should be clear, then this can really build up a little economy branch for people in other countries and give them perspectives. And that is very important, that people have perspectives in their own homelands. Next slide, please. Next slide, please, again. Our project has 1 million trees, and to reach the goal of 1 trillion trees, we would need 10 more projects worldwide. And the app is the beginning to collect these different projects. And that is what you personally can do. You can do by your own, or with your colleagues, or with your firm, or with your community. You can download the Plant for the Planet app in the App Store, in the Play Store for Android mobile phones, and of course online you can use the tools of the app as well at the website trillion-tree-campaign.org. Next slide, please. And the app has different functions. You can, at first, everybody has his own tree account where you can count the trees you plant by yourself or you donate. When you plant a tree, you can make a photo, and which is very important, you have to register the place where you planted the tree. and then the tree is automatically added to your tree counter. And when you plant it, when you donate a tree, the different organizations take different amounts of money for their trees. We take €1 per tree, and that is we are sure that with this €1 we can grow the tree, plant the tree, and save the tree from cutting down and so on. And also we are taking care of the trees, and in the first years the planting members cut down the grass or which is growing around the trees, because in the first years the grass is sometimes growing faster than the trees, and the trees need the light, so they have to remove the grass in the first years, and after that the trees are strong enough to grow by themselves. Our planting area has a growing rate of 90%, which is very good, because some other sometimes not much less trees succeed in growing. And which is another nice tool of the app, next slide please, is that you can make presents with the trees. You can donate trees and then give them as a present to your friends. Next slide, please, which are this is just a few pictures of ambassadors who speak in front of other people to convince them and to show them our app. Here are now 7 pictures, and dear Dr. Potter, you just can, after a few seconds, put the next picture, because this picture are just impressions of our academies where we educate other children and youth to become climate justice ambassadors. So the 7 slides show 7 steps of our academies. The children learn how to speak and take a presentation, and they plan own projects, and they of course also plant trees. Normally these academies are 1 day long, at the moment online, but normally outside in the forest and then in a building to do this theoretic work. And another nice tool of the app, which I forgot to mention, is that you can do little competitions. You can invite your friends and say who plants the most trees in 1 month, or who plants the most trees by himself and donates trees for friends. So this app has lots of nice tools which shall make tree plantings and climate protection more popular for everyone. For people who go into the forest and work with their hands and make their trousers dirty, and also for people who just want to donate and stay in their room. Next slide, please. Yes, now I come to an end of my presentation. This is the One for Trees is a project where we collect money for all tree plantings. Next slide, please. Okay, and now I'm excited to may answer your questions. And with this picture, I think that is there 1 picture more? Okay, this just shows our planting organizations, which are all in the app and where they plant trees. Maybe there's another slide. Sorry, I forget them. But it should be at the end now.
This is wonderful to hear two tree experts talk about how nursing can get involved. So it looks like there's a question from Millie, and the question in the chat says, regarding green prescriptions for those without access to green spaces, this could be like preaching a diet of fresh fruits and vegetables to a person who lives in a food desert. Are there large-scale initiatives to increase access to green space, or are there other creative solutions?
Thank you. Wonderful question. So I'll start by, I'm not sure that I clearly defined green prescriptions, but I'll just do a very quick definition. So green prescriptions, not that common in our country, in the United States, but more so in other countries. And what it is a health professional's written advice to a patient to be more physically active, to become outdoor, have that outdoor time in nature. But it's not as prevalent here in the States, but in the UK and in Canada, we're seeing this become much more common. Green prescriptions fall under something called green care. And this is a whole body of work, of ways to care for people in a more nature-based solutions. That falls under an umbrella term called social prescribing. So why I'm mentioning this as being important is because when you're speaking with somebody, let's say, who is, their BMI puts them in the obesity stage, they don't have access to green space, they're on limited access, they're type 2 diabetic, you see the profile I'm building. How do you then look at the person? Well, first of all, if you're green prescribing, as I mentioned before, you should have received training. But just in the moment, how would you address this with this person? I always say use a stepwise approach and go back to that patient-centric foundation. What is important to this person? What are their preferences? And using a stepwise approach, you don't give them the end goal and say, well, 120 minutes in nature every week, taking a walk in the park for X amount of time so that we could begin to see this benefit. That's not what you're going to be starting with. You're going to start with where the person's at and seeing, maybe sitting by the window in an urban city and looking at the sky and just sort of listening to the birds. Maybe that's the first step. It's the same with any other aspect of nursing. We start with the patient where they're at and help them go from there. In that concept I mentioned of social prescribing, which is very popular elsewhere, there are what they call link workers. These are people that help individuals to connect to things that they need. So if this person isn't taking walks, maybe there's a walking group. Maybe there's a program that this person might be interested in. So I hope that one day social prescribing becomes a little bit more popular in our country because it's extremely effective and they work really well with the clinical healthcare providers. But I hope that answers your question a little bit.
That was great. And the underlying question really was about justice and when there's inequities and when people don't have access. So that's why we need more nurses on boards. We need nurses working for on board for park systems and being at the table to make decisions about how we revitalize neighborhoods and how we turn empty lots into green spaces, how we put benches on streets so that elders can walk longer distances, how we create safe communities. So it's all tied together. In yes. Creating, and I love that you mentioned safety because that's
well. Thank you, Dr. Potter. Because I will tell you, and I tell everybody the same story. My story never changes. I grew up in New York City, born and bred, and in the 1970s I was born and raised in a place called Washington Heights, and I lived there until I was in my 30s. And at the time when I was growing up, it was very. There wasn't a lot of safe access to green spaces. So that's where I'm coming from. And I totally understand and need to include that whole health equities approach to this, because you really can't talk about the benefits unless you address those inequities. But who better than nurses to speak up at the policy level? I belong to the ONS, the Oncology Nursing Society, and we have a program called Health Policy Liaisons. I was lucky, very fortunate, I should say, to be elected as my chapter's health policy liaison. So that means bringing issues of my community to legislators. You can look at your boards, the ANA, you can look at whatever boards of nursing that you work with. There are elements of policy change there. And then again, going back to that diagram of looking, I strongly advocate that community hospitals participate in contributing to the development and co-creation of these green spaces, even if it's on their own healthcare campus, but certainly within their communities. I believe that hospitals are obligated and really should be contributing to this. So find who's the champion in your hospital that's willing to look at the data.
And form partnerships with perhaps your facility managers or the people who do groundskeeping for your organizations. Nurses paired with these folks can be a powerful combination. And we talk a lot about, in nursing, about underrepresented communities. And one of the greatest underrepresented communities are our future generations. So Johannes, it has been so important for us to hear from you, for us to picture the world the way it is and what will happen if we don't address this, and why it's so important for nurses to work on behalf of the next generations for healthy environments. And your talk was so inspiring that everybody wants to know how to get involved for Plant for the Planet. So besides downloading the app on our smartphones, and besides giving trees to people and relatives, for gifts, or fellow nurses for gifts, or to honor patients, if somebody wants to really get involved at the organizational level of Plant for the Planet, do you have some ideas for us?
Oh, yes, thank you for this question. And you can contact the Plant for the Planet office in Germany, but they have an international team which speaks better English than me. And there have been academies, this 7-step workshops for children and youth, also in the US, of course. And you can ask people in the office where the next academy is planned and can get involved in this academy. And the contact data of the office is in the website or at the app. And they are always happy to build up connections, especially in other countries than Germany.
Well, I know that you mentioned you have graduated, you're in sort of a gap year, and I think all of us that are faculty at schools of nursing are thinking, we hope you become a nurse. So you might put that in your thought process, Johannes. We would love somebody who's as articulate as you and bright as you and cares about the planet as much as you, to be involved in our profession. I hope you all can see that this is not a stretch for us to care for the planet, whether we're eating healthy or moving in healthy ways. It is our role and our job to be informing our patients and the communities we care for of ways that they can care for their own bodies, but at the same time care for the planet and ensure healthy futures. So I want to maybe ask each of our speakers to close us out with one thought. If you have one more message for us, what would you like us to close the day out with? So Johannes, I see you lit up. So if you can start, that would be wonderful.
Okay. Thank you very much. To plant a tree, maybe for you as nurses, and not only nurses, but also, sorry, I forgot that vocabulary. You are people who bring babies to burn, to born.
Yeah.
What is the name for it?
You deliver babies, or like a,
yes.
yeah.
you can plant a tree for newborn people, and the trees grow with the people, with the person, not in the same speed, but for this person, it's nice to see when the person is a bit older to see this tree was planted at my birthday. Now this tree is my personal tree and grows with me.
I love that. And when you raise a child with a love for the planet, a love for trees, that will serve them well their entire lifetime.
Yes, that they save them, and that will prevent that they cut a tree just because they want to have money out of this tree also. Yes, that will build up a connection to nature so that they deal in a lovely way with nature.
That's wonderful. Thank you so much. Millie, what would be your closing remark?
There's a term that I use, or phrase I use, nature transcends. And so by that I mean, no matter what, that's the one thing, and that maybe there's more, but it's the one thing I can always think of or refer back to when I think it transcends socioeconomic status, it transcends countries, culture. Every single person that has ever been born has some relationship and connection to nature, to the natural environment. From the moment we're born till we transition, there is some perception and some connection to nature. And that's the great equalizer.
And people know that we protect what we love. So it's important to get children, families out as often as we can. And even just having a plant, start with planting one plant, as Johannes said, one plant that you can watch grow and appreciate how you care for a plant really sets us on.
Absolutely. Absolutely. And I don't mean to take up more time, but I'll go back to my childhood as an example. I lived in an apartment, right? And that apartment faced other apartments. And so me and my sisters would take the seed of the avocado and we would put toothpicks in it and we would grow it at the windowsill. And that act of nurturing that plant, and I was facing a building, but it was something, it was that connection. And it shouldn't be expensive. It should be readily accessible to what you have in your environment.
And this is nursing. Caring for the planet is caring for the humans that we love, the communities we serve. It is not two separate things. It's absolutely interconnected. So it has been my great privilege to host this conversation today. Thank you, Millie, for your excellent presentation. And Johannes, thank you for inspiring us and giving us a way to plant trees to begin to heal our people and our neighborhoods. So thank you all so much. Check us out on Nurses Drawdown. Please become a member. Look at all the activities that you can do to be part of Nurses Drawdown and spread the word. Nurses are most trusted sources, and we want to get this information out there broadly to everybody who will listen. Thank you all and have a wonderful day, and plant some trees.
Thank you.